In 2019, the National Vaccines and Immunization Program piloted the malaria vaccine in 8 counties in Western Kenya, namely Homa Bay, Kisumu, Migori, Siaya, Busia, Bungoma, Vihiga, and Kakamega. Kenya has so far administered more than 1 million doses of the 4-dose vaccine to children across the 8 counties, with almost 400,000 children receiving at least 1 dose.
As the pilot progressed and more data became available, WHO now recommended that the vaccine should be used on a broader scale to prevent malaria, particularly among children in sub-Saharan Africa and in regions where there was moderate to high Plasmodium falciparum transmission.
Since the introduction of the vaccine in 2019, the country has witnessed a drop in the number of children hospitalized for malaria and a consequent reduction in child mortality. The first dose of the vaccine is administered from 6 months of age and the fourth at 2 years of age over a period of 18 months.
Our goal as a program has been to reduce malaria incidence and deaths by 75% of the levels of what it was in 2016 by the end of this year. So the scale up of malaria vaccine to the remaining 26 sub-counties in the high burden counties, or the lake endemic region, what we call, is actually very appropriate and timely.
The World Health Organization has further recommended the vaccine for broader use in Kenya, Ghana and Malawi, but plans to expand access to the entire African region have been hampered by low vaccine supply.
We currently only have one manufacturer for the vaccine, and we have limited supplies of the vaccine. And so this type of tailored approach of looking at how we can phase in to the countries is also what's happening throughout the region. Starting with those areas with the highest levels of transmission, the greatest burden of ill health due to malaria, those are the areas that are initially being targeted for the introduction of the vaccine. And then as the supplies increase, and working together with the other malaria interventions.
The program now intends to scale up vaccination to other parts of the country as efforts to begin a phased introduction in other countries across the continent begin later this year. Muriel Adhiambo, K24.